Uh, Thank you very much, Dr. Meg. Thank you so much for your time. And it's a pleasure actually to have you on board at Waltham International College, obviously in partnership with Leeds Trinity University. I think obviously before we give an introduction of your, but we were actually very impressed the presentation you did on 18th of October last year. I think it was a wonderful event in Central, and obviously you traveled from Cardiff to London, so that was another, I think, as a new experience for you as well. But I think obviously I was witnessing your presentation. As you noticed that I was also a part of the presentation panel. So it was quite fascinating to me because the research you did, obviously your involvement with the sheer department in Cardiff, obviously you're involved in research as well, and obviously you have a lot of exposure in terms of this neurodiversity. So we thought, it will be very fruitful for us. But just to give you a background, we have degree programs here. Obviously, we do health and social care as well. We've got business and IT as well, and we have a master's program as well. And obviously, we are thinking to expand. We are already working towards the expansion. One of our strategy. I will introduce, our principal as well. Suren Reader is there with us as well, so she will give a little bit of intro to you as well, how the institute, how the college is working, what exactly the strategic plan we have. Because obviously, it's an initial plan. We bring you on board for this presentation. So in this meeting, we have been joined by our academic teams, like lecturers. We've got module leaders from business and health and social care as well. We've got management here, and we also have our support team from Birmingham campus and from London campus as well. Our employability and placement department is also here. We have our registry team available here, and obviously we have all other departments, including attendance and all these things, like all the key departments. So hopefully, the idea is obviously your presentation will be on neurodiversity. So that would help us because we actually cater mature students, Dr. Meg here. We have mostly students are mature. So this thing sometimes becomes quite challenging to identify whether it's a neurodiversity or something. And obviously then we're trying to learn this as well. But before obviously we go further, I will ask Suren, if you don't mind, if we can hear you, and we can take a little bit of words from you, and then obviously we'll give a stage to Dr. Meg. Suren, can you hear us? Okay, we have also been joined by Mr. Tossif from our Birmingham as well, and we have also our management side as well. That Mr. Pervez will be joining us as well. Tossif, sir, you want to say a few words? I think they're all online, so I think we're trying to see anyway. But anyway, we'll give it time during the presentation. I think at some point we can hear from that. But just to give you all guys just a bit background of Dr. Meg, she works at Cardiff University at the moment, and obviously she will give a little bit of introduction to herself, and then I think we can start. So Dr. Meg, over to you, and I think you can start.
Thank you. So my name is Meg Kiseleva. I currently work at Cardiff University, and we do evidence reviews in health and social care. The presentation that I'm going to be giving to you today is based mostly on the work I did when I was at Birkbeck, University of London. I worked for the Centre for Neurodiversity Research there. And also I'll be signposting you to other useful resources and research that is being done in neurodiversity. And as I talk, please feel free to interrupt me, shout out. If I don't see the chat, if I don't see your hand, then just speak up, because it's much more productive when we have a discussion rather than just me talking at you. So how do you want to do? Do you want me to share my own screen? Because then I can change my slides. Might be easier that way. Let's see if it works. So different organizations, so there may be a bit of a hiccup with sharing, but let's see. Okay, can you see it now? Is it?
Yes, we can see.
Is it full screen?
It's in full screen, yeah.
Oh, perfect. So I'm going to briefly talk about a couple of projects that we did when I worked at Birkbeck, because we did research both with neurodivergent students and neurodivergent employees. And I'll be sharing some of the insights that we found when we were working on those projects. And as I said, I'll also be sharing some resources that you might find helpful. And it's really good that we have a mixture of teaching staff and support staff here, because it's the whole infrastructure that needs to take these things on board in order to make like a marked difference. So it's very good to see such a good turnout from the different departments. So first of all, so what is neurodiversity? Nobody can agree on what it actually is, but the definition that we use and the definition that you often see is that the neurodiversity is the breadth of human cognitive functioning. So essentially it's how we perceive the world and how we interact with the world, and that includes absolutely everyone, not only people with ADHD, not only people with autism, but every single person on Earth. It's like biodiversity. Every plant is somewhere within what we refer to as biodiversity, and the term neurodiversity actually originated from the term biodiversity. And there is another term, neurodivergent, and a lot of people don't like this term because it has this part divergent, which means that it's atypical. So it's used in research. If you use it, you need to define what exactly you mean by that. And just as with many other terms, if a person doesn't like to be called that, we don't call them that. But a lot of people identify as neurodivergent. So there is never any agreement in any inclusivity research on what terms we're actually supposed to be using, because different people have different opinions. But the definition I'm going to be using in this presentation is neurodivergent is an umbrella term, and we use it to refer to people with conditions such as ADHD, autism, dyscalculia, dysgraphia, dyslexia, dyspraxia, or developmental coordination disorder, different mental health conditions, tic disorders, and others. And the taxonomies vary because someone will tell you that it's only ADHD and autism that is neurodiversity. Some will say that if it's everything on this line up to mental health conditions. So this term is used differently, and in different definitions, it's more or less inclusive of different conditions. And again, people may consider themselves to be neurodivergent, they may not. But so when you see a piece of research, they usually give a definition of what exactly it is that they mean by that. And again, views and terminology vary. Some people may be quite displeased that it's so narrow, others will be displeased that it's too broad. So it's important to, when you talk to people, to bear in mind of what their preference is if you're doing something that is supposed to be to cater to them. So I'm going to briefly talk you through some of the things that we found when we did a piece of research for the charity Neurodiversity in Business, which was published last year. And then at the end of the presentation, I'll signpost it to different resources, and that includes that report. So we surveyed about 1,000 of neurodivergent adults in employment and also their employers. And we asked them about what strength they thought they had as neurodivergent people. And we also asked their employers the same question. And in this slide, kind of the red, kind of burgundy, the burgundy strip is what the neurodivergent worker said on average, and the green one is what the employer said on average. But in our sample, so because it was neurodiversity research, even on the employer side, it was mostly neurodivergent employers who took part in it. So there is a lot of agreements there, but if you sample random people from organizations and ask them to talk, and specifically neurotypical people, by the way, neurotypical is not a thing. We use it as a shortcut. There is no average person. There is no typical person on Earth. But neurotypical is like, you know, in law, when we refer to a reasonable person, it's sort of like that. There is no single typical reasonable person, but it's just a useful word to have. So this is the way I'm using the word neurotypical. Don't mean that there is a typical person. So if you survey a random sample of employees, I think there will be a lot more disagreement. But what people generally said is that they were creative, they had new ideas, they were very good at hyperfocus, so they were able to focus on specific tasks for long periods of time. And when you're in that hyperfocus mode, you can do so much work. And the way a lot of neurodivergent people work is they have stretches of time when they're incredibly productive, very often at the expense of eating, sleeping, attending to their other physical needs because they are very much in the work. And then they can't focus at all. That happens a lot, especially with people with ADHD. Is detail processing, so innovative thinking. I guess that's also linked to creativity, but you will see that the employers rated it higher than people themselves because they think that because there is this stereotype that neurodivergent people are very creative, which is a very good stereotype to have because it's positive, but it can sometimes go a little bit into the fetishizing territory when you think that all autistic people are really good at math, or they'll know all about trains. Obviously, that's not true. That doesn't describe every single person. And there are people who are not so good at those things and who are not interested in those things. But because of those stereotypes, it's more difficult for them to get a diagnosis, to get support, because they're not recognized as autistic, because they don't fit those narrow stereotypes. So this is something to bear in mind, but still, I guess, positive stereotypes are slightly better than negative stereotypes, so that's already something. And we also asked them about what they struggled with, so what challenges they had. And we only asked the neurodivergent people, the neurodivergent workers, and not their employees, because we didn't want to give them ideas. If you give people a list of things that someone is bad at, then there is a chance that they will internalize it and they will feed into the negative stereotypes that they may already have, or you may give them other negative stereotypes about a group of people. We wanted to avoid that because there is already a lot of stigma. So we only asked neurodivergent workers themselves. And the highest rated item was looking after yourself mentally. A lot of people said that that was something that they found challenging. And it's because a lot of the assumption about how the world operates are built on how what we refer to as neurotypical people think. And so fitting into that world creates a lot of additional challenges. And so you get things like anxiety, for example, because you don't know what is expected of you, and your whole life you've struggled to work out what it is that is expected of you. And so those things build up. Then concentration was another huge one. And if you look at the previous slide, the second rated item on this slide was hyperfocus. And in challenges, the second rated item was concentration. And those go hand in hand. For example, ADHD, so it's the attention deficit hyperactivity disorder. And there are a lot of conversations that the word deficit doesn't really represent what it is, at least the way it's understood in everyday speech. Because you can argue that in the medical vernacular, deficit actually means difference, or some people say that, but in everyday speech, we understand deficit as something that you don't have enough of. People with ADHD do not have enough of concentration, don't have enough of attention. It's just the problem is directing your attention and the executive functioning and deciding that you're going to focus on this task. You sit down and you do the task. When you have ADHD, very often you don't really have a lot of choice about what you're going to be concentrating on, because your brain presents challenges and directing that attention. So deficits, it's the difficulty in directing it. Asking for help when you need it was another one that a lot of people said they struggled with. And it may as well be because there are a lot of assumptions. For example, in universities, there is something referred to as the hidden curriculum. So all the things that students are not told directly, but are expected to do, because the assumption is that everyone knows that you're supposed to do those things, so you don't write them down. And a lot of neurodivergent people, for example, autistic people, can struggle with that because the rules that are unspoken and obvious to other people may not be obvious to them. And so your whole life, you go through life thinking about what other rules there may exist, and they may just not understanding it. Is it really obvious? Or is it something that is actually okay to ask? Will I look stupid if I ask for help? So all these questions can make your life at university, life at work, really stressful. So you're looking after yourself physically. So if you are in hyper focus mode and you've been working on an essay for 8 hours straight because you're really in it, you're in the flow, then you forget to eat, you forget to sleep, and that can lead to not feeling as well as you can. And then again, that may affect your performance. Um, so I'm the slide just before the last, I'm given a list of references, and you can have a look at the reports that we published last year, and there is more information about this. Now I'm going to be talking about something a bit more specific to students in higher education. And you mentioned that you have mature students. I worked at Birkbeck before, and you will know that Birkbeck is also very much aimed at mature students. But before I go ahead, are there any questions? Anything you would want to discuss?
Yeah, thank you, Dr. Meg. Wonderful. I think there is one raised hand. We have Mentis, not he is actually a year lead for our health and social care program, so he will be asking you some questions. Yes, Mentis, over to you, please.
Thank you. Thank you. My question is regarding the challenge, and most of the answers on the challenge are something personal and it is more subjective. But on fine motor control, there is 40.5%. And is that a physical inability, or can you just explain to me about that?
Yeah, for example, what will used to be called officially dyspraxia, now officially it's the developmental coordination disorder, is, and one of the features is that people may struggle with, well, motor control is basically how you control your body, and that can make detail-oriented, like manual work more difficult, so people may struggle with that and get frustrated. So in academic context, it really depends on what it is that you're doing, but it may not come up if you're doing purely academic work. But for example, things like sports, university sports, I think it used to be called the clumsy child disorder, which is not a very nice name for it, but clumsiness is something that is associated with it, which may not be the best word to describe it. So does it answer your question?
Yeah, absolutely. Thank you so much. Thanks.
Thank you. Are there any other questions? Oh, yes, there is a question.
Hi, Dr. Meg. So nice to have you on board, and thank you for what you've covered so far. My question is regarding the physiology of human beings, in terms of in relation to wearable technology these days, to detect, if people are going into emotional breakdown, or, they're struggling with their emotions, and they could be, struggling with what their symptoms are. So how successful are we with these wearable technologies these days?
That's not something that I've ever looked at. You mean wearable technologies like a smartwatch that can tell you your heart rate? Is that kind of thing?
Yeah, exactly. So there are some devices which are monitoring children's and students' heart rates, and also when they've got sweaty palms or they've got cotton mouth, these kind of activities are happening with their body. So the physiology is being detected by those devices to pass a message to the teacher that this student is currently struggling. So
yeah, I think it's very interesting. It's not something that I've seen any evaluations of. To think about, maybe something to think about is if they're constantly wearing those devices and they're constantly aware of their heart rate, of how much their palms are sweating, it can sort of start a little bit of a feedback loop. Oh my God, my heart rate is higher than normal. I must be anxious. And if you're not, so that may make you more anxious. But it would be interesting to see evaluation studies of how that works, because what you want is not the monitoring per se, but being able to take action. And I'm going to be talking about something called compassionate pedagogy, which is a paradigm that people are bringing into neurodiversity research. And there are some ideas there on how you can implement it without that kind of monitoring. But is it something that you use in your teaching, that kind of devices?
no, we haven't come to that stage yet, but me and another colleague, Dr. Arman, is also part of this meeting. We have actually written an ebook on teacher burnout, and we've taken a totally different stance on it. And the stance is the teacher's relationship with the students and how it can impact the students, from their body language, their gestures, their, what to say, how to say, and when to say, etc. So, and while doing that research, we came across this interesting technology that wearables can actually identify it to the students and to the teachers as well that this particular person is struggling. So that's why I thought I'll just discuss with you if you've got any experience in that, and we'll be happy to collaborate as well if there's any chance.
If you do any research on that, if you test it, please do let me know, because I think it's very interesting. But
Sure.
yeah, a lot to think about.
Sure, sure. Thank you.
Yeah,
I appreciate
thank you
that.
for
Cheers.
sharing.
Thank you. No problem.
So I'm going to go ahead so that I can finish in time. But if as I go, you have any other comments or questions, please do let me know. Just get back to the right screen. There it is. So in terms of how many neurodivergent students we think there are in higher education, and if your students tend to be older, these numbers may not be representative, because I think that they've mostly been sampled at more traditional universities where students tend to go to right after school. But the numbers that we have, and they're very rough estimates, is that up to 2% of students in higher education are autistic, between 2 and 8 have ADHD, that about 5% are dyslexic, but these numbers may be hugely underreported because a lot of students are not diagnosed, a lot of students don't disclose, and especially if you have mature students, because there is a lot more awareness of these things now. Younger people tend to be more aware that it is a possibility that they're autistic. People in their 30s and 40s and 50s may not even think about it. There are a lot of autistic people with ADHD who go through life and think that everyone's brains work the way theirs does. So the numbers may be the same, but detection rates may be very different in different age groups. And one of the reasons why it is so difficult to say how many students are neurodivergent is that a lot of the time they don't disclose, and there are lots of barriers to disclosure. They may be afraid to be stigmatized or being labeled, being singled out in class, because they know that their peers are going to notice if they constantly access accommodations and reasonable adjustments, and they may want to avoid that because a lot of them will have had very traumatic experiences as children in school. They may worry about privacy. What if everyone knows that they're different? They may think that there aren't enough supportive policies, so it doesn't make sense to them to disclose because they're not going to access supports that way. Also, some say that they just want to have a go on their own without supports, and they want to be more independent. For example, if they had support plans at school, when they go to university, they may say, well, I actually want to try without it. Is there a question? So I thought the mic was on. If there is a question, please shout out. And other things is that a lot of people are not diagnosed. It takes years at the moment to get diagnosed. From the moment you realize that you may have ADHD, it may be 5 years until you actually get a diagnosis on the NHS. Private diagnoses are very expensive. And so there is this barrier to being diagnosed. And universities tend to be able to diagnose dyslexia internally. So they may test students for dyslexia, and then based on their internal testing, students may access support. With other types of neurodivergence, they can't do that. So if they can't test students for ADHD in-house. And also if it was an educational psychologist who diagnosed someone with ADHD, that diagnosis is not always recognized because it's not considered to be proper diagnosis. So lots of barriers there. A lot of people choose not to pursue a diagnosis because they may think that if they get a diagnosis, it's going to put that on their medical records. They may face medical stigma, they may face stigma in the workplace, they may be discriminated against, and the kinds of supports that they will be able to access with a diagnosis are just not worth all those risks. So a lot of people just never bother with diagnosis, and that is why in the neurodiversity movement that sort of tries to go away from the purely medical model of disability where you see it as deficiency and where you think that you need a specialist to diagnose you. So within the neurodiversity movement, self-diagnosis is encouraged, and accepting self-diagnosis is encouraged, because the worst thing that may happen is that someone who thinks they're autistic are not autistic. That's not the end of the world. It just shouldn't be a problem. But if someone thinks that they're autistic and they've done research, they've looked into it, they've spoken to other autistic people, they think that their brain works the same way as someone they know is officially recognized as autistic by professionals, then fair enough. Self-diagnosis is very important when there are so many barriers to receiving official diagnosis, but you can't access adjustments on the basis of self-diagnosis. So that's another problem. And a lot of people are just not aware of their own neurodiversity because they may think that everyone thinks the same way, or they just don't know that it's a thing, or they don't have access to resources and they've never thought about it. So a lot of people will not even get to the stage where they consider getting a diagnosis. And in terms of how well neurodivergent students are currently thought to be supported in higher education, so well, the short answer is not very well on average in general. They tend to have higher dropout rates of higher education and a lower quality of life than peers who are not neurodivergent. But again, this is on average when we talk about this as a broad group, and obviously there will be huge variation within that group. There are a lot of people in academia who are neurodivergent, who are autistic, who have ADHD, who have other types of neurodiversity, and a lot of them will tell you that it is actually their neurodiversity that has helped them achieve such high academic roles. Because, for example, they have a special interest in something, and it may be that it is because of their neurodivergence that they are so invested in it and they're so focused on it, and that they can thrive in that environment where they're supposed to be doing this one thing. But again, a lot of variation. You can't just say that it applies to every single person. Some people already thrive in that environment. But the aim is to make sure that everyone has the same opportunities, and if they already have good support networks, they're more likely to thrive. If they don't, then what we ideally want to do is to make sure that there is the scaffolding, there are those support networks, and that they can achieve their potential. So the poor outcomes that are referred to in research, that's documented in research, are thought to be linked to the educational environment. So it can be things like the curriculum, like the program structure, like the structure of the assessment, whether support is offered or not, how easy it is to access that support, and not the academic abilities, because again, it depends on the definition of neurodiversity that you're using. But for example, autism is not an intellectual disability. It can happen together with an intellectual disability, but in itself, it is not. So autism in itself is not going to affect a student's academic abilities. And the reason why they may have a more difficult time at university is because of the way education is structured, the way the building is designed. If there is a lot of noise and they can't concentrate, because sensory issues is a huge thing that a lot of neurodivergent people experience, and it can feel almost physically painful to be in a noisy environment. And if you imagine being hammered on your finger as you're trying to write an essay, that's you can't fulfill your potential and you can't focus in it because you're focused on your finger hurting. So it can be very similar when you're in a noisy environment, or if there are bad smells, if the light is too bright. And so because often it's difficult to find environments where you can concentrate and not being distracted, so that can also feed into how they perform. But in the right environment where there are no barriers to thrive in, that's where they can achieve their potential, which is something that we're trying to work towards with this kind of research. So we've done a review of the current supports and the effectiveness of current supports that people can access, well, mostly on student support plans. And the review is, it's a rapid systematic review of reviews. So we've looked at the research that had already been published and then summarized the findings of those evaluation studies. And it is currently under review. We're really hoping it's going to be published later this year, but the academic publishing process takes a very long time. So watch this space. We found that there is quite a lot of research into evaluating the supports that are available to students, but the quality of research is not great because, well, first of all, because it's very difficult to get funding to do proper, let's say, randomized control trials, or a randomized control trial may not be ethical in some situations. And so the studies are small, so they're underpowered, the study designs are not great. So it's very difficult to tell for sure if the existing supports are actually helpful. But some of the things that we found is that, well, the examination adjustments and specifically giving people more time at examinations had mixed results. And because all of the study designs were very different, the time given, the standard time given for the exams was different, the additional time was different. Those studies were not really comparable, but some of them showed that giving people more time helps. Some said that if the standard time was already long enough, then it obviously didn't help because everyone managed to complete it in this really long standard time. So the results were mixed, and some of the conclusions of this kind of research is that for some students, coursework is a much better way of assessment than putting them in an exam hall with the timer ticking, because to some people that is very stressful, and also it's very, very likely not something that they're going to be doing at work when they finish university, because very few workplaces have this kind of environment, and you're able to consult materials, often given more time than an hour and a half, obviously not always, but given alternative ways of assessment can be helpful. Another thing that's showed promise is strategy instruction. So when you help people understand how to approach their coursework. So it's so for example, the strategies to approach writing an essay, the strategies to approach learning new material, because they may not have come to university already having those skills. And there are also lots of evaluations of different coaching and mentoring programs, including peer mentoring programs. Again, they had quite mixed results. They had some positive outcomes. They were mostly done with students with autism and ADHD. And one of the things that was a recurring theme in that research is that accommodating their personalities, their thinking styles, was very important for the effectiveness of coaching. So, in terms of how current provision is structured, so it's based on the disability services model. So you get a diagnosis. So if it's dyslexia, you go for a diagnosis at your institution. You have to disclose that you're neurodivergent. Again, there are a lot of conversations about whether neurodiversity is disability or not. Some people say yes, some people say no. There's very little agreement. A lot of people don't want to be considered disabled because there is so much stigma around disability. That is a whole other conversation. But to access adjustments, they need to declare disability, they need to have a diagnosis. It puts a lot of pressure on them to come forward and go through all this really tedious paperwork, and it can take months and months. If they apply for a student support plan before they start education, then they may have it from day one. Doesn't happen very often because you have these 18-year-olds who have just finished school and they go into a completely new environment. Very often they move away from home. Often they move to a whole other country. There are so many new things. And then there is this additional stressor when they're forced to go through, to understand and go through this very lengthy process of accessing adjustments. And if you take a student with ADHD, there are already so many things to think about. And when you struggle with executive functioning, you don't want even more work to access help that is supposed to support you with these very things. And, so this model is underpinned by deficit thinking. This is a quote from a very good paper on compassionate pedagogy by Hamilton and Petty. I think they are both at York St. John University, and they're doing some research into universal design for learning, which I'm going to be talking about. I really recommend this paper because it has some very good insights into how you can think about supporting students better. The thing that both this paper and a lot of current research are talking about is that we can change educational design to embrace difference from the start instead of making people individually go through this process. And so there's this paradigm called universal design for learning. There are many publications about that. It is not, with its effectiveness, it's not very well researched. So at this stage, it's quite theoretical. So what research shows is that, well, it makes the process of learning easier and more engaging, but we don't really have hard data on whether it works and worked for everyone. But as a theory, it seems appealing. So what it says is that you need to think about the differences in how your students percept and interact with learning materials, the curriculum, the course. So, for example, providing multiple means of engagement with course materials or representing them in different ways. So, for example, you may have a lecture video, you also send them textual slides. Your course materials may come with a text-to-speech app, so instead of reading, they may listen to it because they may perceive information better when it's presented in the auditory manner. A lot of neurodivergent people have auditory processing difficulties, so that's the opposite side of it. They may not be able to listen to a recorded lecture and understand it, so they are going to, or rather they will struggle with it. They're going to need closed captions and other written materials, and that's expands from neurodiversity to other types of disability, to physical disabilities. If you have deaf students, they're not going to be able to listen to a recorded lecture. They are going to be needing subtitles, closed captions, and textual materials. So this is a module that is not specifically designed for neurodivergent students, but for different types of disabilities. And at the heart of it is making sure that everyone has the same access. And that means presenting things in multiple formats, giving people different ways of engaging, for example, working as a team, working individually, doing a written assignment, delivering your assignment orally. And if all those things implemented, that means that people can choose how they're going to engage with the course. But obviously, it is a lot of work. And one of the things that CAST, so the authors of this, say is that you can't implement it post factum once the course is already in place. It is something that needs to be at the heart of it when you start designing it. And I'm going to link you to the CAST guidelines in case you find them interesting, you see any ideas for what you can implement in them. Some of those things require a lot of effort. Some of the things are very easy to implement. It can be done tomorrow. So, for example, making your materials more dyslexia friendly is something that will require just as much effort as preparing your slides the way you regularly do. So some of the tips that the British Dyslexia Association give, and again, I'll link you to the guide, is using sans serif fonts, so the fonts that don't have these decorative elements because they make them more difficult to read. Using large enough text, so it's 12 to 14 points in your printed materials, larger line spacing, so they again, it depends on the size of the text, but they recommend about 1.5. For emphasis, they recommend using bold text instead of italic or underlining, because then if you use a lot of italics, that text can appear quite crowded. Dark color text on a light but not white background, because it's easier to read when it's cream or off-white. And there are many more tips. There is the whole manual on how you can make your materials more friendly to, well, both dyslexic people, but I'm not dyslexic, but I find it so much easier to read any text that adheres to these guidelines. So a lot of, again, the thing about universal design for learning is that it's supposed to improve accessibility for everyone, not just for a group of people. So it's not individual based. And some other things that can be done by default is lecture recording with closed captions. So if they missed something during the lecture, if they got distracted, they can go back and rewatch it. Closed captions, well, as long as they're not automatically generated text, but someone has at least looked through them and edited them, help people with auditory processing issues. Sharing materials in advance of the lecture, at least a day in advance, ideally more, will allow people to have a good look at what is going to be presented so that they can have a think about it and do more intentional listening, so they know what is important and what they need to be listening out for, and they can do some preliminary work. So materials in alternative formats, assistive software, I think these go hand in hand. For me, it's very often easier to listen to materials because I process information better when it's spoken in my ear. So often, even at work, I've put some things that I need to read through text to speech and then listen to them. Not always. Sometimes I prefer reading things, but then when you have a choice between different alternative formats, then you can decide what is better for you in a specific situation. Having access to a resource center, for example, if they can go to someone who can help them with structuring their essay, with grammar in the essay, with spelling, then that can be helpful. In quiet rooms, a lot of libraries these days have quiet rooms. If there are quiet rooms or quiet areas on campus where people can go to decompress if they're feeling that they're getting overwhelmed, that can help them focus better. and making sure that what is referred to as the hidden curriculum is clear, so that people know exactly what is expected from them and exactly what they're going to be assessed on. So when you think about student support plans, so one of the things that happens very often, so you have a student with ADHD, they've disclosed their disability, they're supposed to be able to access accommodations. What are you going to do? You give them more time for their assignments. And what happens with a student with ADHD? So instead of writing their essay at night on the 4th of May, when they need to submit on the 5th of May, they give them a 2-week deadline. They write the night before in 2 weeks' time. That is not helpful. And they often have very little control over it because it is how their brains work. A lot of people with ADHD work better under deadlines and under deadline anxiety, which is a very poor self-regulatory mechanism because it can lead to a lot of issues later on. If your whole self-regulation is based on anxiety, that is not healthy. But the fact is that when you have a deadline, that means that you have something to focus on, and shifting the deadline to the future is not necessarily going to be helpful. It may be helpful for some people. It's not going to be helpful for everyone. If there are other mitigating circumstances and they can't complete an assignment within that time, then obviously they need that accommodation. But it's not something that is helpful as a default because they just have a different timetable, but then runs into the very same problem. So thinking about how to structure the course in a way that people don't run into a problem when the whole term they don't need to submit anything, and then let's say they have this one assignment that gives their full mark at one date, and then they stress out the night before and they don't perform as well as they could have been if they had been doing things incrementally throughout the course. But again, we don't really have high quality evaluation studies that assess the efficiency of those things. And this is something that we desperately need if we want to understand which adjustments are helpful. So this is my last slide. To create a neurodiversity inclusive environments, there are some things to think about. Attitudes take a very long time to change. There is still so much stigma around neurodiversity. A lot of people still don't understand what it is. If you've seen the 80s film Rain Man about an autistic brother, then a lot of people still have this idea of what autism is. Others will just not know what it is at all. And this goes for every kind of neurodiversity. There are a lot of negative stereotypes that still exist. There are also overly positive stereotypes that hold people to unattainable standards. But having conversations about that, talking to people, also creating an environment in which neurodivergent people will tell you that they are neurodivergent, and they will, if they feel safe enough to do that, means that you'll be able to have these conversations with them. And creative and inclusive environment takes a lot of effort, and it needs to be concerted, collaborative effort, so it can take time, but the journey has to start somewhere. And there's this good expression, nothing about us without us, and it applies to all kinds of inclusivity work. That essentially it means that if you're going to do something for a group of people, you need to be talking to those people about what it is that they need, rather than making assumptions. So having a conversation with them, including them in decision making, is very important. But the fact that there are so many people from so many different parts of the college here today means that the journey has already started, and it sounds like you're already doing a lot of work, which is delightful to see. But yeah, there is always more to be done. But the thing is that people can have conflicting needs. So the possibility that we will achieve a situation in which everyone is equally accommodated. So it is very difficult, mostly because of the conflicting needs. But the more we talk to people, the more we think about it, the closer we can get to it. So you have my slides. This is just a reference list of the things that I referenced in this presentation, and I've highlighted some resources. So there's the British Dyslexia Association Dyslexia Style Guide. If you just Google it as it is, it's probably going to be the first hit that comes up. The CAST, Universal Design for Learning Guidelines, they have a graphic organizer that is visually so easy to look at and see if there is something you can immediately implement. They also have published guidelines. And I really recommend the Hamilton and Petty paper on compassionate pedagogy. Again, they reference universal design for learning. And I think at York St. John, they're doing some evaluations of universal design for learning in their courses now. So hopefully, if they haven't already published, then they will soon. It will be interesting to see what they found. And I need to acknowledge Professor Salma McDowell, Professor Nancy Doyle, who I worked with when I worked at Birkbeck. We did the Neurodiversity at Work reports together. And also worked with Almuth when we did the review of adjustments for neurodivergent students in higher education. And so the charity Neurodiversity in Business, who commissioned the Neurodiversity at Work report. If you're interested, it's the last reference on this slide. You can see what else we found. Let me just stop sharing so that I can see you. We have a little bit of time, so if you have any questions or any points you'd like to raise, please go ahead.
Thank you so much, Dr. Meg. Thank you. I think it was fantastic. I think we really enjoyed. Obviously, there are a couple of questions before we comment, but there is a question, I think, in the chat as well. So let me go for that first. There was a question, how can we self-diagnose ourselves in higher education? Like any comment, any suggestions on that?
Research, doing a lot of research into what it is, reading about it, talking to people. There are lots of diagnostic tools on the internet. They cannot be used to definitively diagnose a person, because the way diagnosis usually works is you talk to a professional, you often complete those questionnaires, and then you have an extensive interview, and often they ask you to supply references from other people who know you, stories from your childhood. So it's a very extensive process. But your self-diagnosis works on doing a lot of research and talking to people. But if you've done all that and you think that you're autistic, then it is your right to say that. And even if you are not going to be able to access official accommodations, just knowing about that may help you think about what accommodations you can create for yourself. So I think this is what self-diagnosis is important for, because if you don't know what you're dealing with, or if you don't have a good idea of what you're dealing with, then it will be more difficult to come up with strategies to help you deal with it better.
Absolutely. Thank you so much for this. We have, obviously, like I said, we have a support mechanism here. And the team, we call it as the ACE team, obviously, Clinical Community of Acting. So Maria, obviously, writing a comment in the chat. I think Dr. Meg, you mentioned about the adjustment of assessments, coaching and mentoring, we can see from your research. I think one thing that's very interesting is accessibility aids in terms of the teaching material. I think that's what Maria has mentioned. I think it's very useful, the tips you have given actually to us in our slide, because obviously this is one of the key things which I also find sometime in research, and obviously having the feedback from students, like obviously the material is been designed such a way, so then obviously it's been addressed without them, they are coming and disclosing us. We should keep in mind actually prior to designing the material. So this was very interesting. And you mentioned about some student support plan as well. We obviously have Renin here from our team as well, and Maria, and obviously other team. Yes, we do also a support plan for students. But I think I agree with you that I think there's a more depth required in terms of looking into more detail. And I think we can address. There's a question actually was mentioned about, because Dr. Meg, what we do actually at the moment, we have got some non-credited modules where we actually try to bring, for example, confidence, for example, some other skills which they really need to cater in terms of their assessment and the performance. So there was a question related, do you think that additional kind of, the modules are also quite necessary, isn't it, into the curriculum, which can support this kind of neurodiversity aspects?
So do you understand it correctly, that it's in terms of teacher training?
Yeah, exactly. That I think in the chat, Vikas has asked this question.
Yeah, I think it's very important because these are the students you are going to be dealing with because they will be in your class. So just having that awareness, and also the more awareness you have, the more likely it is that you're not going to have the negative stereotypes, because the more you learn, the fewer stereotypes remain. Then I'm not sure what exactly is happening at the moment in teacher training, so I'm not the best placed person to answer that, but it's definitely something that is important.
Sure. Thank you so much. We have Emeka Luke from Birmingham campus. He is actually a year lead for business. So Emeka, please, you have a question.
All right, thank you, Usmani. All right, thank you, Dr. Megan. I just want to can you guys hear me?
Yeah.
Yes.
Okay, so when you were teaching this, I was just reflecting on one of my students. Each time I give a group work, this student is always the first to answer for the groups. He never allows anyone else to answer. And then I now discover some of the examples you gave about giving these students different other methods to kind of, so I decided to use more of individual work for the students instead of taking over the whole group. And this student is always hyperactive, non-stop. But then when it comes to submitting the assignment draft, the student doesn't submit. So it tells me that the student waits until the last minute. But when I looked at the data and the statistics you put there in the third slide, workers and employees of those universities believe that students with those ADHD have memory loss, whereas the students had more numbers that they don't have memory loss. So that's kind of interesting that we in the academia, lecturers, staffs, and other are thinking that these people they have memory loss, whereas they believe they don't. So it's kind of interesting for me, and I believe this is something I have to also work in my practice to try to give them, especially now we're talking about inclusivity in higher education, to give them more, even for our admission team and our staffs. When people come to you with those hyperactive comments and non-stop, we should try and understand where they're coming from and how we can support them. Thank you very much.
Yeah,
Thank you,
thank
Luke.
you. Yeah, I completely agree with you because it is very difficult to manage a class of students, isn't it? And especially if there are students who like that, who are very outspoken, who take over the group. So it is difficult to find strategies how to make sure that others have access to being able to speak, being able to participate. But yeah, in terms of memory, so there is a distinction between like working memory, so something that you've just heard, something that you just thought about, and you keep it at the front of your mind, and long-term memory, so something that happened 10 years ago, you remember. A lot of neurodivergent people really struggle with working memory, not all of them. So you've just had my phone in my hand. 5 seconds later, I have absolutely no idea even what room it is in. So that is something that definitely happens. But yeah, in terms of what you describe, I don't know the students' individual circumstances, but it sounds like there may be ways to help them manage it a little bit better. So, but again, just it is difficult to help each individual student, isn't it? Especially if you don't know the details of their circumstances.
Perfect. Thank you very much, Meg. Meg, I understand the time as well. I think we'll take the final comment or a question from Faisal Iftikhar. He's one of our business lecturers. Faisal, over to you, please.
Hi. Thank you very much for that. That was an excellent presentation I've just attended. And also thank you for that great shout out to Rain Man, my personal favorite movie. Dustin Hoffman was obviously excellent in that. So I have just an observation. I'm not sure if it's right or not. Do you believe there is a cultural bias when we look at neurodivergent people? Like most of the sample sizes, do you think they're taken from this Western country or Western belts, because let's say if we have a diverse group of students. If a student has come from a country or a locality whereby, let's say, competing for resources is the norm, he or she might appear to be slightly more hyperactive, slightly more forward, slightly more aggressive. But that's how he or she was brought up. That's what the culture they were in. Or if you look at a Japanese person, let's say, who works endlessly, tirelessly, 100 hours a week or 80 hours a week, the crazy hours, it might look like they have slight or mild OCD, if I may. So do you think there's like a cultural bias or cultural element when we look at neurodivergent people?
Definitely, I completely agree with you, because the diagnostic criteria are based. Well, if we look at the DSM-5, for example, that's an American diagnostic manual. The diagnostic criteria based on what the psychiatrists in the US historically thought was normal in their society based on their cultural norms. In Japan, for example, it's impolite to have direct eye contact for an extended period of time. So in the Western world, we think that, well, autistic people struggle with eye contact and it's weird because we're supposed to maintain eye contact. That wouldn't be an issue in Japan because they're not supposed to maintain eye contact there. So definitely lots of cultural assumptions. Also, a lot of the research, especially English language research, is based in the US and the UK and other Western countries on Western assumptions. And also, even within that research, for example, autism research is so much biased toward white male people, white male children specifically. And so we don't necessarily know how it manifests in other people, what other people struggle with. They tend to have much more difficulties accessing supports, accessing diagnosis, because you look at a child who doesn't fit your stereotype and think they can't possibly be autistic. There is something different with them. And very often people from more marginalized backgrounds are misdiagnosed with a lot more stigmatized things. And so it makes their lives a lot more difficult.
Thank you for your response. Thank you.
Thank you.
Thank you, Dr. Meg. Thank you so much from on behalf of Waltham International College, and obviously personal thanks to you as well, obviously for your time. I do understand your commitments and the timing, but I think we managed somehow. But I think it's a pleasure moment for all of us. Obviously, at the end, like I said, I think it will be a pleasure for us to have you on board anyway. Whenever you're in London or in Birmingham, please do let us know, and we're more than happy to have in-person session with you as well. I think at the end, we would like to say thank you so much to you. So I will just take an opportunity now. We have a team from Birmingham. We have Mr. Tosif, Suren, if you can join, or Pervez as a principal, if we would like to say thank you so much to you. If anyone is here, please.
Yeah, hi, Meg. Sorry, Suren had to prepare for an urgent issue. I'd like to thank you. I think it's very, very informative, very interesting. Mainly for me and for, I'm sure, others as well. And thank you very much for this session. It was really great.
My pleasure. Thank you so much for having me.
No problem.
Thank you, Dr. Meg. Thank you so much for this. And obviously, I was also looking into Cardiff University that you've got a STEM there. It was interesting, like diversity in STEM, and I was reading like obviously some of the articles and information, which is interesting as well. So it's very useful, and thank you so much to you as well. And obviously, great work which you're doing at Cardiff. So wish you all the very best, and definitely will be in touch with you for upcoming.
Thank you so much. Pleasure to meet you all. Thank you.
Thank you, everyone.
Okay, bye.
Bye.
Bye. Bye. Bye.